Meeting to order. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Mapes, would you lead us? Well, good morning, everyone. Good to see your smiling faces. Can we have a roll call, please, Mel? Can't hear you, Melanie.
Commissioner Turnbull,
Here.
Good morning.
Commissioner Aaron's, Commissioner Mason.
Here.
Commissioner Van Alstine, Commissioner Hankins.
Here.
Commissioner LeVanway. Here. Commissioner Chamberlain,
Here.
Commissioner Mapes.
Thank you. Friendly reminder to everyone, please make sure you've got that mic right up close to you. It's not necessarily for the benefit of those in the room, but also for the benefit of those on Zoom. Would anyone like to add or remove any agenda items? Okay, hearing none, we're going to move on from there to review and approval of the meeting minutes from July 2nd. Anyone like to make a motion there?
I'll make that motion.
I'll support.
Moved and seconded. Any further discussion? Any changes that need to be made? Hearing none, can we have a roll call, please, Mel?
Commissioner Mason,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Hankins,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Mapes, Commissioner Aaron's,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner LeVanway. Yes.
All right,
Motion passed.
thank you. Ladies and gentlemen, that moves us to public comment. If you'd like to address the Board of Health, you'll have 3 minutes to do so. We'd ask you to step to the podium, state your name and where you reside. I will give you the friendly 30-second warning that your time is about to expire. Good morning, Ms. Lieberman. How are you?
Mary Lieberman, Emmett County. Two things specifically I wanted to mention today is one, I want to thank all of you on the board for your service and dedication to this health department. It's appreciated more than you know. Lots of times we have controversy and disagreements on things, but we truly do appreciate your service. The second thing is this is primary voting day. It's an important day. I understand that I believe 5 of you might be in the primary election today. So I'm encouraging people to get out and vote, and please show your support for the candidate you believe is best to serve your area. And some of you, I understand, of those 5 have had to face adversity and some pretty nasty negative campaigning. But despite that, you have functioned and served with integrity and conducted yourselves in a manner that we truly as constituents appreciate. Again, please make sure you get out and cast your votes today. And again, we appreciate your service. Thank you.
Thank you, Mary. Would anyone else like to address the Board of Health? Okay, hearing none, we will close public comment. Moves us to staff reports. Mr. Thorell is unavailable today, somewhere in the UP wearing a swimsuit and no cell coverage. So we are blessed with Ms. Campbell today.
Thank you. Can you all hear me?
I think you need to turn that on.
They changed the microphone. I might have to hold.
Yeah, I think it's on.
Yeah, just take it out of there and hold it. There you go.
Singing now.
Celebrity style.
There you go.
All right, thank you. Yes, Dan is on some well-deserved PTO. So I will be brief and bright here with my report for this month. Just a quick update on the fiscal year 25 state budget. And this pertains to some items that will come later on the agenda. But the first point and update I want to make is the Kindergarten Oral Health Assessment Program, or as you all know, we love our acronyms in public health, is KOHA or COHA. This program is to screen all incoming kindergartners to have a dental assessment done, really similar to hearing and vision that has been, gosh, I think we're crouching in on almost 70 years of doing hearing and vision screenings in the schools. So now we're going to be adding oral health to that. So the state budget, they did come through with an increase of $2.5 million to fully fund that statewide program, which brings the overall budget for the kindergarten oral health assessment program to $4.26 million. We are unsure currently of what the health department in Northwest Michigan will be allocated. They're working on a funding formula, and we're fortunate enough that Shannon has been chosen to be on a committee representing rural local health departments. So we know that our voice will be heard. And this will come up again later when we talk about some other agenda items. And the other piece is that the hearing and vision programs also saw an increase, first time in 25 years. So there was a $2.5 million increase for the continuation of those programs screening for children. Each year, there's approximately 85,000 children that are referred to hearing and vision specialists from that program, and about 1 million of them are screened each year. So that's really all I have. Is there any questions?
Any questions for Holly? Okay. Any questions for any of the directors who are present that have submitted written reports? Mr. Van Alstyne.
Jeremy, is there any update on the state sanitarian code? Okay, thank you.
All right. Any further questions for any of our directors? I joked that we were going to be done at 10:59, but let's keep moving. You had your chance. That moves us to committee reports. Personnel and Finance Committee, Ms. Levanway.
We went through the bills for July, June. Oh, we have to approve the June bills. Yes, right, the June bills. I will make a motion that the Finance Committee met to review the bills and employee expenses and would like to make a motion for the full board to approve of the June 2024 bills in the amount of $645,334.34 and the June 2024 employee expenses of $18,686.43.
Second.
Moved and seconded. Any further discussion? Hearing none, Mel, can we have a roll call, please?
Commissioner Aaron's,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Hinkins,
Yes.
Commissioner Van Alstyne,
Yes.
Commissioner Mapes, Commissioner Levanway,
Yes.
Commissioner Chamberlain, Commissioner Mason.
Yes.
Motion passed.
Thank you. Do we have, those were June's bills. Do we have July's bills also?
Not yet. No,
Not
we
yet.
have not done them yet.
Okay.
Next week, I think.
Well, and because we had, we didn't have a meeting last
Right.
month.
That's
July
why.
being what it is in Northern Michigan. Okay, Ms. Levanway, are you gonna be presenting on, or Holly, are you picking up on the oral health program administrative lead? Those two job descriptions?
Yes.
All right, thank you.
Okay. So in the committee meeting this morning, we had discussed a couple of job descriptions that we're hoping to add to our classification schedule. So with that kindergarten oral health assessment program being a change to the Michigan Public Health Code, Also comes funding, and with funding comes work. So we are proposing that we add in to our classification a oral health administrative lead. And this person would be responsible for clinic setup and tear down, handling expensive dental equipment, participating in billing, doing some documentation, things of that nature to really make sure that that runs smoothly and is coordinated throughout our 4 counties. We created the job description and we scored it with our scoring tool. And it does come out to a classification level 7. This is a non-exempt position. And I think really other than that, this lead will report to our community health supervisor, which falls under the community health division, which is Janine. I think that
We
is
have
it.
both job descriptions in the packet also, I believe.
Yep, both job descriptions are in the packet.
You want to roll right into the second one?
Sure.
Covering both?
Okay, so then the second position we're hoping to add is registered dental hygienist. And historically, what we have done at the health department is we have had registered dental hygienists as independent contractors. Well, with some changes to the IRS regulations regarding independent contractors versus employee, we really are feeling, especially our human resources and our leadership team, that we need to have those hygienists come on as employees of the health department. And that is due to, we dictate the location of their work, when they work, the policy on how they work and what they do. So because of those factors, we really feel that we need to have them come on as part-time. Now, when I say part-time, I mean really part-time. We have about 1,400 to 1,600 kindergarten students in our 4-county region. And typically in the past, we've had 4 to 5 hygienists that are mostly retired that want to still contribute to the community and to their trade. And this really we are anticipating would be 15 to 30 days per year. So we went through and we also created a job description for this from what we had been using previously. And this classification level would be a level 9.
Okay.
And all of this is, funded through that program that we are now going to be doing permanently.
All right. Thanks, Holly. And again, this is a state mandated move, correct?
Correct.
Okay. Anybody have any questions for Holly on either of the job descriptions? We're going to vote on these individually, but do you have any questions regarding either the oral health program admin lead or the registered dental hygienist positions? I believe there are additional staff members, or one would be.
Yep, one would be an additional staff member that we have in a different classification currently. And the hygienists are still contracted employees currently, but then we would be moving them to a full health department employee.
I think it's more or less a move to comply with IRS regulation, and
Yes, compliance,
we're dotting i's and crossing t's.
that we are.
Okay. Is there a motion in our packet to address those also?
Yes.
Yes,
I know we had one a little bit ago.
right after the job description.
I will make a motion to add the job description of oral health administrative leave to the Health Department of Northwest Michigan's classification schedule at a level 7.
Moved and seconded. Any further discussion? Hearing none, Mel, can we have roll call, please?
Commissioner Chamberlain,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes, Commissioner Mason,
Yes.
Commissioner Hankins,
Yes.
Commissioner Turnbull.
Yes.
Motion passed.
Would anyone like to make the second motion for the registered dental hygienist?
I'll make the motion to add the job description of registered dental hygienist to the Health Department of Northwest Michigan classification schedule at level 9.
I'll second.
Moved and seconded. Any further discussion there? Hearing none, can we have roll call, please?
Commissioner Levanway,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes, Commissioner Turnbull,
Yes.
Commissioner Mason,
Yes.
Commissioner Hinkins.
Yes.
Motion passed.
All right. And then next, Ms. Levanway.
The next one has to do with the amended budget. I think Shannon will bring out that information.
Oh, yeah. Sorry about that, Dawn.
All right, thank you. If you all recall, about a year ago in September, I brought forward the initial fiscal year 24 budget. Things change as we go through the year. There are funding sources that we didn't know about that come out later. Perfect example is the kindergarten oral health screening that you just heard about. I'm sitting on the committee to determine the funding formula for it. So that's not the only one that we have. So we put together the budget to the best of our knowledge, and then we wait a little while, see where it all falls. So what I'm bringing before you today is the fiscal year 24 amended budget. This has the funding that we have now confirmed, and we are more than 3/4 of the way through the year. So we have a really good idea of where we are and where we sit as we come into the final part of the year. If you look in your packet, you will have a very colorful spreadsheet in there. There's columns with all kinds of different colors. That is the 24 amended budget. What I'm really going to focus on today is the last 3 columns. They're all kind of different shades of blue. The first one, the bright blue, is the fiscal year 24 final agency budget, and that's what we will be approving today. That's what I'm bringing forward. The second column, the kind of purplish blue, is a fiscal year 24 initial budget. That's what I brought to you last year. And then the final column is the difference between the two. So you can take a look, and I know it's small on this when it prints out on a single page, and my apologies for that. But I just do want to highlight some of the major things and variances that you will see in there. Overall, our budget has increased 9.2% from the initial budget that I brought forward last September. Most of this is due to the dental division. We are doing more services than ever. If you recall, last year in January, the feds changed the Medicaid reimbursement rate, and we now get a higher rate of reimbursement for the dental services that we provide. And then in April of last year, they also expanded the services that are allowable under Medicaid. So now we're doing crowns and things like that we were not able to do before. So combine those two, and we're doing more than ever. In addition, we got a one-time SPA settlement. SPA is the state plan amendment. And basically that covered the difference between what Medicaid would reimburse and what private plans would reimburse, that difference. That's no longer an issue now that they changed it in January of last year. But we are one of like 2 or 3 health departments that have a dental section, and the state kind of backburnered it for the time being. They had other things going on, and we finally sat down with them and got it all straightened out. They owed us 1 year, we owed them 1 year, back and forth. We settled it all, and so those additional dollars came in this year. It is a one-time payment. We will not have it anymore because the SPA program has ended. So that makes up for the majority of the revenue increases that you will see. On the expense side, as dental is doing more procedures and they've got more patients, you're going to expect that they're going to have additional salaries and things that they're going to have to pay. You will not find it in the salaries and wages line of our budget because they are not HDNW employees. You will find it on the contractual and consulting line because we pay Dental Clinics North to manage and staff our dental clinics. So the contractual and consulting line has increased quite a bit, and that's mostly due to dental and those pieces. The other line that you're going to see increase on expenses is fringe benefits. And there's 2 things going on here. This is all thanks to that SPA settlement that we received. First of all, we decided it would be wise to go ahead and add additional funding to our pension liability. We are currently 82% funded. And I'm sorry, 84% funded, and we would like to increase it to 92, 93%. It would have been great to fund it to 100%, which would cost us about $1 million. But we have increased medical insurance expenses coming our way this year. And we do not want to put all this money into the pension and then turn around and not be able to cover our health insurance costs as they rise. So we're going to do half of it this year with the intent to do the other half next year if we have the funding available and we can cover our medical insurance costs a different way. So we are asking for a $500,000 addition to our pension liability, which will require board approval today before we approve the budget. I made an assumption and assumed that you would agree to that. And so this budget that you see before you includes the $500,000 for the pension. If you do not approve it, that's fine. I have another version with me that takes that out. So I came prepared. The other piece I talked about is the medical insurance expense. We had to true up that account to the tune of $1.1 million. And you have to remember that we are self-insured. We pay for all the actual claims that our employees incur under our medical health insurance, and costs have skyrocketed much more than we were expecting. So we needed to true that up and get that squared away. So we've got that taken care of with those two line items. And the other thing I wanted to talk about really quickly is the other expenses category. I've broken this out in the past, and I just want to remind you that we are trying to be more transparent. The other expenses line item in the row to the very far left under expenses, right above it, you have expenses that used to be all bundled together in the other category, and we've now broken them out. So that includes advertising media, other contractual computer software, and health services. So those are now broken out from that other expenses line. Of course, there's still the other catch-all. We can't have a category for everything, but it does break it down a little more so it's not all clustered in there. At the very bottom, you will see our total net surplus has increased. Originally, we expected a surplus of about $49,000, and now we're close to 1.1 million surplus. And if you look at all the colorful columns all the way across the bottom, you will notice that the gray column, which is the dental division, carries the entire 1.1 million. And that's where that surplus is coming from. That's due to the additional services and the increased rates that we're getting. So with that, it's a lot of information. Oh, I would be remiss if I did not mention the person sitting next to me, Andrea Pierce. She has done the heart of this budget work and helped put it together. So I do need to thank her for all of her work, the rest of our team as well. But Andrea's put a lot of work into this, and I brought her. So if you have any questions between the two of us, we can answer, and we'll be happy to do.
Any questions for Shannon or Andrea, since she's going to throw you under the bus?
Yes. What do you see? You're speaking to everything that you were able to produce for this year to raise the levels to match the inflation. What do you see coming up in the next year or two? What are we looking at next year?
Well, are we talking the budget in total?
Yes.
So we're preparing the fiscal year 25 budget as we speak. We are going to bring that to you in September. Our funding, unfortunately, most of our funding sources do not increase with inflation. They're flat grants, and you have to remember most of our funding is grant funded. So we don't see increases in our revenues very often, with the exception of the KOHA. Hearing and Vision got a little more, EH got a little more this year. So we're still working through that to see how that's going to pan out. But yes, to your point, our costs still increase. So we will work through that. We do have, this healthy reserve this year, which we will put into our fund balance and hold on to that for that rainy day should we ever need it. But we will go ahead and present a balanced budget to you in September, and we will figure out a way to do it. Maybe we have to cut here, maybe we cut there, maybe we do things differently.
Thanks.
You're welcome.
Any other questions for Shannon? Okay. Hearing none, would anyone like to make the motion regarding pension liability?
I will. I'll move that the Health Department of Northwest Michigan fund an additional $500,000 to the pension liability in fiscal year 2024.
I'll second that.
Moved and seconded. Any further discussion?
Nice job on keeping that funded.
Yeah.
Yeah.
That's nice, 92%.
That, I mentioned in our previous meeting that 92 to 93% funded is phenomenal.
I
Charlotte
can't
County
take-
would like to be
Yes.
in that position. And
I
we're
can't-
working on it. We'll
Yeah.
get there.
I can't take all the credit. I have to credit predecessors for being wise financially with that, but we'll keep it going for sure. Thank you.
Any other questions or comments? Hearing none, can we have roll call, please, Mel?
Commissioner Chamberlain,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Henkins,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes, Commissioner Mason,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Turnbull.
Yes.
Motion passed.
All right. Moving on then, would anyone like to make the motion for the fiscal year 24 budget amendment?
I'll make a motion that we move that the fiscal year 2024 budget amendment in the amount of 37,514,244 be accepted and approved by the Board of Health.
Moved and seconded. Any further discussion? Roll call, please, Mel.
Commissioner Chamberlain,
Yes.
Commissioner Mason,
Yes.
Commissioner Mapes, Commissioner Henkins,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Levanway.
Yes.
Motion passed.
All right, outstanding. That moves us then to unfinished business. And I had made a motion to table Commissioner Chamberlain's motion. So I'm going to make a motion that we remove that from the table at this time, which would reopen Mr. Chamberlain's
Bring it
motion, I
back
believe.
from the table.
I'm sorry?
Bring it back from the table.
I'm bringing it back from the table. Again, I am not an expert in Robert's rules, but I do want to make sure that
You wouldn't want to remove it. So,
I want, no, I don't want to remove it. I'm
Okay.
bringing it back from the table. Thank
There you
you,
go.
Terry.
I'll second that.
Okay. All in favor, say aye.
I
Any opposed? Okay, that then reopens Mr. Chamberlain's motion, which was a motion to approve the amended Health Department of Northwest Michigan Board of Health bylaws and rules of order with edits proposed on July 2nd, 2024, contingent upon legal review. That was supported by Mr. Aaron's. I believe we have now the bylaw draft in your packet.
I would like to have us adopt option 2. That's pretty much the clearest wording of the 3. They all read exactly the same thing, just a different way, but 2 is the clearest of the bunch. And with the where it says the Board of Health will have elected officers, chairperson and vice chair, the blue area there, I would be all right with accepting that also.
Are you making a motion then to adopt option number 2?
Just discussion. I mean, we'll have to amend the motion once we get to that point. Yeah. I can do that right now if you want.
Okay,
I'll make a, set tight a minute, it's coming. I will make an amendment to the motion that we accept option 2 and to accept the attorney's words on that underneath officers.
I'll second his amendment motion. Any further discussion? Yes, ma'am.
Questions from the attorney that we were to think about was, do we need to put a term like 1 year, 2 year?
I'm sorry.
Do we need to put 1 year or 2 year on these? The attorney asked those questions. It was in our email.
For the term of the
The
chairperson
term
and the
of the
vice chair.
chairperson. I would prefer we did that for a year at a time.
Can we, prior to adopting these, I think that's a separate issue from the amendment that Mr. Van Alstine is proposing. Or wait,
I can
he
add
agrees
that to
to
my
it.
amendment.
no, we just did that. You're right.
Yeah,
He agrees to it. We're okay.
Okay.
I can amend my motion to make it 1 year.
For each of the offices.
Are you fine with that? You seconded it.
Yes, I'm good with that. Ms. Campbell.
In the email that Dan had sent, with the information from Matt Cross, there were the 3 questions I think that Commissioner Levanway is alluding to. If, for consideration, if you wanted to add those in. So I have those here if you want them repeated.
Yes, repeat them. I couldn't remember the other two.
Okay. So it says Matt Cross posed some questions for the board to consider, which could also be added to Article 2. And those include, want to include a term of office. Would there be any limitation on who can be an officer? Example, must they be from different counties? And then further description of duties, or at least leave open the board's ability to add duties as needed.
Which it looks like they pretty much had covered on here. It says what the duty of the chair and the vice chair is, so.
I think under the definition of quorum in here, even if both the chair and the vice chair were from the same county, one of them would have to be present in order to meet the quorum.
Yeah.
Because you need to have a representative from each of the 4 counties. Holly, what was the third one? I'm sorry.
That was all 3 of them.
I know, I'm asking if she can repeat the third one.
The third one was if the board would like to add further description of duties, or at least leave it open for the board's ability to add duties as needed.
It's a living document, so we can address that anytime we want to.
Right.
Yeah. I mean, if we decide we want to add something next month, we can add it and bring it back and adjust the bylaws accordingly, so. I would think.
I think I would be in agreement with you. Yeah. Okay, so, Mr. Van Alstine proposed adding a 1-year term limit to the position of chair and vice chair. And I agreed to his friendly amendment. Is there any further discussion?
And to accept option 2 and the writing underneath Article 2 about the Board of Health officers was my amendment.
Yes.
Okay, great. Thank you.
Any further discussion? Okay, all in favor, say aye.
Aye.
Any opposed? That motion passes. Okay. So that brings us back then. Trying to keep all this straight. I think that brings us back now to Mr. Chamberlain's initial motion.
No, it's an amended motion and
Yeah.
you passed.
An amended motion, yes. Okay,
I opted to amend the motion. The amended motion was
Amended.
seconded, and we passed that. That would automatically carry his over.
okay. Are we done then?
Yes,
Everybody in agreement that we're done? We've adopted these.
that would be the right, because we voted on the amended motion, which it passed, so there wouldn't be any reason to vote a second time on the amended motion.
Okay.
Yeah.
Okay,
I would say that it passed.
That's true. That would supersede the
Okay,
original motion.
then we have bylaws. Wow.
We did something.
Stop. Don't jinx it. Okay. New business, we have none. Public comment. 3-minute limit. Ladies and gentlemen, if you'd like to address the Board of Health, again, we'd ask you to step to the podium. state your name and where you reside. We'll give you 3 minutes. I'll give you the 30-second warning. Would anyone like to address the Board of Health? Hearing none, public comment is now closed. Commissioner comment, you also have 3 minutes. Mr. Mason.
Well, Mr. Chairman, I have nothing, but did you and Shannon in discussing for the meeting, you had a motion on me?
No, we did not.
Okay.
Okay. Mr. Turnbull.
We must note that, in the absence of Dan, look how quickly this went. Poor Dan.
Okay.
I hope he's enjoying his vacation and wish him well. and I wish
Yes.
Everybody here well as well. It's always an honor to be here.
That motion that Mr. Mason was referring to was cutting Dan's pay and benefits while he was gone. We did not make that motion. Let's be crystal clear. Let the record show.
We'll make fun of him a little bit. He's a
Mr.
good guy.
Van, that's right. He's not here.
And he's earned his
He has.
time away from us.
Yes.
He's probably very relaxed not being here.
Mr. Van Alstine,
Nothing.
Ms. Levanway,
No, I have nothing.
Mr. Mapes, Mr. Aaron's,
Well said, thank you.
Mr. Chamberlain.
I am good.
I'm gonna echo Mary Lieberman's comments. Nobody takes this job to get rich. Nobody takes this job for a power trip. 10 years ago, I never would have thought that I would be sitting on the Board of Health. But somebody has to do this. And thank you for your service. And I mean that sincerely. And good luck to those of you who are running for reelection. I will take a motion to adjourn.
I'll make that motion.
Move second, all in favor, say aye.
Aye.
Any opposed?
Just look at me.
10:37. Just saying. That's a record.
We'll be Dan about it all.